COVID-19 flooded the world like a tsunami, and there were signs of it coming. But when it arrived, we were hit, and we were hit hard. And from one day to the next, strict social distancing was the new normal. All schools and shops were closed, and work from home was mandatory in most cases. Physiotherapy practices had to close, so we had to adapt to a new reality overnight. And this film differs from my other films, because I will not discuss specific scientific research, but I will talk about the uptake of telehealth by physiotherapists. And my aim is to invite you to share your thoughts, experiences and tips regarding the use of telehealth in the comments down below. And in that way we can learn and help each other. So please use this film to discuss issues you encountered. Hi, and welcome back to Pelvic News channel. And if you like this video, please give it a thumbs up. And if you don't want to miss any future videos, please subscribe to my channel and hit the notification bell down below. Well, 5 years ago I attended a fully booked workshop about telehealth at the annual meeting of the Dutch Association for Physiotherapy. An enthusiastic physiotherapist who was already using telehealth showed us all the possibilities. Was this the beginning of a paradigm shift in healthcare? I don't think at that time, because telehealth was still only used by a few colleagues. But due to COVID-19, face-to-face contact was avoided as much as possible. So all over the world. And physiotherapists had to adopt to telehealth quickly as a new way to provide continuous care for our patients. And in addition, protect themselves for loss of income. A quick search on PubMed regarding physiotherapy and COVID-19 resulted literally in hundreds of articles published between March and today. So I dived into it deeper and selected some articles which I used to write some of the text for today. And you can find some of these articles in the description down below. Well, I live in the Netherlands, so that is my reference. So due to the fact that the healthcare systems, reimbursement, and last but not least, the internet accessibility is different country by country, not all that I discuss might be applicable for your situation. I will first discuss barriers regarding the uptake of telehealth, and then I will discuss some practical and important issues to consider. So why was the uptake of telehealth before COVID-19 so slow? And there are several factors that can contribute it, like organizational factors, like the internet access, affordable technology, reimbursement from healthcare insurance. And there are patient factors like age, education, computer literacy, and factors concerning the healthcare professional themselves, like the willingness to change. Is there enough knowledge regarding technology? But also the idea that telehealth is not personal, and issues regarding patient safety and privacy. So due to COVID-19, telehealth was implemented rapidly in the Netherlands, like in many other countries in Europe. And today face-to-face treatment is allowed again. However, local lockdown can be necessary in case of a new rise in infections. And therefore, I think it's time to evaluate and consider if there is a place for telehealth in treating patients as part of usual care in the future. Telehealth can be offered, for instance, as a standalone, but also in a hybrid form. And in a hybrid form, some consultations can be face to face and some with telehealth. And we know, for instance, from evidence that a lot of women do not know how to contract the pelvic floor muscles properly. So, an investigation of the pelvic floor and good instruction how to perform the pelvic floor muscle exercises is important. But choosing for telehealth can also depend on the complexity of a case and a lot of other issues. And another issue that we should not forget is, of course, the reimbursement. It's not within the scope of this film to discuss how to choose the appropriate telehealth software. However, I would like to emphasize some important issues to keep in mind. So, does the telehealth software of your choice meet your national privacy and security regulations? And does your insurance, your liability policy cover e-health, telehealth? And check, and if yes, is it necessary to get patients' consent for teleconsultation? Patients always need to get information on what telehealth is, the difference with face-to-face consultation, the advantages and disadvantages. And I think what we need to think is, will COVID-19 result in a paradigm shift in the use of telehealth and maybe even lower the cost, have an influence on the cost of healthcare? So I hope you will discuss these items. Feel free to leave a comment down below. Share this video. Give it a like if you like it, of course, a thumbs up I mean, and subscribe to my channel. And well, thank you for watching and see you next time. Bye bye!